The job description of an MDS coordinator involves overseeing the assessment and documentation process for residents in long-term care or skilled nursing facilities. MDS stands for Minimum Data Set, a standardized system used to evaluate the physical, psychological, and functional status of patients. The MDS coordinator ensures that these assessments are completed accurately and submitted on time, helping facilities maintain compliance with regulatory standards and secure appropriate reimbursement from Medicare, Medicaid, and insurance providers. An MDS coordinator, often a registered nurse, RN, or licensed practical nurse, LPN, serves as a key liaison between clinical staff, administrative teams, and regulatory agencies. Their role blends clinical knowledge with administrative precision. They interpret medical data, coordinate care planning, and ensure that each resident's health record reflects their current condition. Without the MDS coordinator's careful oversight, a facility could face compliance risks or financial losses due to inaccurate reporting. This position is essential in promoting quality care and accountability. By combining nursing expertise with documentation accuracy, the MDS coordinator plays a central role in aligning patient care with both healthcare standards and funding requirements. Primary responsibilities of an MDS coordinator. The core responsibility of an MDS coordinator is to manage the assessment schedule for all residents. This includes initiating, reviewing, and finalizing MDS forms within regulatory timelines. Each resident's data must be entered into the facility's electronic health record system and submitted to government databases without error. Another key duty is to ensure the accuracy of data. The coordinator collects information from nurses, therapists, dietitians, and social workers to complete comprehensive assessments. These details form the foundation for care plans, reimbursement levels, and compliance audits. Meticulous attention to accuracy and timeliness is essential. Care plan development is another vital function. After compiling MDS data, the coordinator works with interdisciplinary teams to create individualized care plans tailored to each resident's needs. This ensures that clinical interventions align with assessment findings and regulatory expectations. MDS coordinators also educate staff about documentation requirements and assist them in understanding how assessments influence care and reimbursement. They may provide in-service training sessions, answer questions about coding, and ensure that staff follow proper charting procedures. Regular audits are part of the role as well. The coordinator reviews completed forms for inconsistencies, missing information, or discrepancies between medical records and assessment entries. If errors are found, they initiate corrective actions promptly. Communication and collaboration are continuous responsibilities. The MDS coordinator attends care plan meetings, interacts with healthcare providers, and works closely with facility administrators to maintain compliance with the Centers for Medicare and AMP, Medicaid Services, CMS, guidelines. Essential skills and qualities for the role. The role of an MDS coordinator requires a combination of clinical expertise, analytical thinking, and organizational ability. Strong attention to detail is the cornerstone of success. Since reimbursement and compliance depend on accurate data entry, even minor mistakes can lead to financial or legal consequences. Analytical and critical thinking skills are equally vital. MDS coordinators must interpret clinical information and apply it to standardized assessment tools. They need to recognize patterns, identify discrepancies, and ensure the documentation reflects each resident's true condition. Communication and teamwork are central to daily work. Coordinators interact with nurses, therapists, physicians, and administrators, ensuring all parties understand the importance of accurate and timely documentation. The ability to explain complex requirements in simple terms helps create a culture of compliance. Technical proficiency is another crucial skill. MDS coordinators use specialized electronic systems for data entry, coding, and submission. Familiarity with EHR software, medical terminology, and CMS regulations is essential. Time management and prioritization are critical. With multiple assessments due each week and frequent deadlines, coordinators must balance precision with speed. Effective scheduling ensures that no report is delayed and every resident's record remains up to date. Empathy and professionalism are also key traits. While the role is primarily administrative, MDS coordinators are still nurses at heart. Their work directly affects patient care outcomes, so understanding and compassion remain central to their approach. Work environment and challenges. MDS coordinators typically work in nursing homes, assisted living centers, or rehabilitation facilities. Their workspace is usually an office within the clinical unit, allowing easy access to staff and patient records. The job combines computer-based tasks with frequent communication across departments. The workload can be demanding, especially during regulatory audits or when multiple assessments are due simultaneously. Deadlines are strict, and accuracy is non-negotiable. A coordinator must remain calm under pressure and organized even when juggling multiple priorities. One of the major challenges of this role is keeping up with changing regulations. Healthcare documentation standards evolve frequently, and coordinators must stay informed about updates to CMS guidelines and reimbursement rules. Ongoing education and professional development are therefore essential. Collaboration challenges can also arise. Coordinating input from multiple disciplines requires diplomacy and persistence. Not all staff members may understand the significance of accurate MDS data, so the coordinator often takes on an educational and motivational role. Despite these challenges, the position offers a strong sense of purpose. MDS coordinators ensure that residents receive care plans that reflect their needs and that facilities are recognized and reimbursed fairly for the care they provide. At this midpoint, it's important to emphasize that the job description of an MDS coordinator extends far beyond paperwork. It represents the bridge between quality clinical care and the administrative systems that sustain healthcare delivery. Educational requirements and training. Most MDS coordinators are licensed nurses, typically registered nurses, RNs, or licensed practical nurses, LPNs. A nursing degree or diploma is therefore the minimum educational requirement. Some facilities may also consider experienced healthcare professionals with relevant documentation or compliance experience. Training is usually provided on the job, focusing on MDS software, assessment protocols, and regulatory compliance. However, many employers prefer candidates who have completed specialized certification, such as the Resident Assessment Coordinator Certified RACCT credential. This certification demonstrates advanced knowledge of MDS procedures, coding, and compliance standards. Continuing education is vital. Since CMS frequently updates MDS regulations, coordinators must stay current with training seminars, webinars, and professional workshops. Experience in long-term care or rehabilitation settings is highly valuable. A solid understanding of geriatric care, patient assessment, and interdisciplinary collaboration enhances the effectiveness of an MDS coordinator. Strong documentation skills, familiarity with clinical terminology, and proficiency in healthcare software systems are all assets in securing and succeeding in this position. Conclusion. The job description of an MDS coordinator outlines a role that combines nursing knowledge, data management, and regulatory expertise. These professionals ensure that every patient's needs are accurately documented, care plans are properly developed, and facilities remain in compliance with healthcare regulations. The role is both challenging and rewarding, offering the opportunity to impact patient outcomes while contributing to the financial and operational stability of healthcare organizations. Precision, accountability, and leadership define their daily responsibilities. For nurses who enjoy organization, analytical work, and teamwork within a healthcare setting, becoming an MDS coordinator provides a fulfilling path that bridges clinical practice and administrative excellence, playing a vital role in maintaining the quality and integrity of long-term patient care.